Welcome back to the Hair Restoration Institute. My name is Nathan Brusky.
And I'm Dr. Gary Petrus.
And today we're talking about procedure sizes. How large of a hair transplant should one do? How can one tell how large of a hair transplant they might need? And so, Dr. Gary, when we do hair transplants, we think of them in terms of how many grafts does someone need? Like, what's a graft?
Well, a graft is a little small piece of tissue taken typically from the donor area, which we consider the back of the scalp. And the reason we take them from there is because the occipital or the back of the scalp area is just genetically different. God just made us differently back there. We don't lose our hair. And we've all seen men and some women that lose a lot of hair on the top, but they keep hair in this ring in the back.
Yeah, so we tend to lose our hair up here. Bald people will still kind of have that horseshoe of hair because it's all permanent hair back here on the sides.
Yeah, exactly. It's just it doesn't respond to hormones and stresses the way that the hair in the front and top does. And some people don't have that condition. In some patients, the entire head has got the type of genetics like the back, and their hair really doesn't ever fall out. But they said Ronald Reagan died with a full head of hair.
Yeah.
So, but most patients do have that situation where their front and top and side of the hair does respond to stress and genetic and hormone changes.
So one graft is that piece of skin tissue that has that hair follicle in it.
Yeah, and we consider a follicular unit different. So a follicle is actually a little growing organ that has a little blood vessel, a little nerve, and actually a little muscle too. And when the muscle contracts, your hair stands on the end, which is like goosebumps.
Yeah.
If you're frightened or have a goosebump, that's what it is. That muscle contracts. So, but sometimes our body is designed, has a beautiful design that has little groupings of hair follicles together, and that's considered a follicular unit. Usually it's maybe 2, 3, 4, up to 6 hairs, sort of like a palm tree. They'll come out. Although the follicles are individual, that grouping of follicles is we consider one follicular unit. So a graft could be anywhere from 1 to 6 hairs, depending on where it's taken from and that particular patient, how their hair grows just naturally. So
people can either have balding where they don't have hair in a certain spot. They can have thinning where there's a kind of loss of density. How do you tell how many grafts someone needs?
Well, that's difficult, and we have a lot of techniques to try to help us estimate it. But ultimately, we don't really ever know for sure until we're in the procedure and we're counting and doing the procedure and seeing how much space we need to fill up. But obviously, the worse the more balding and skin showing, the higher number of grafts you need. Obviously. Yeah. But the question is how much, and we have estimations of a thumb print maybe 100 grafts, or some people say a palm print is 2,000 grafts. But on average, a square centimeter is 80 to 120, follicular units. So but we have also some scopes, some dermatology scopes and densitometers we can actually physically count in the pre-op evaluation. A lot of it is just clinical experience, to be honest with you.
Yeah.
Just a lot of doing this a lot, And patients have different amounts of hair. Blonde patients tend to have more hair, up to 150,000 hairs on their head.
Oh, wow.
Yeah, whereas redheads typically have around 90,000 hairs on their head. And, black hair patients have about 110, and brown hair patients have in the middle around 120. So hair density varies by hair color, so which is kind of interesting. I always think, on average, most people have a good number, say 100,000 hairs on their head, and is a good average. But
so
there are some differences.
About like the different possible sizes that a case might take. What are some most common hair transplant sizes?
Well, in our clinic, hair transplant is an elective procedure. It's really a cosmetic procedure. Although it is a bit of a regenerative and reconstructive, we're kind of putting stuff back that was there. So it's not, pure cosmetics like removing a bump on a nose, but but it is elective, and so we're very safe and careful, and we don't want any complications and stuff. So that's in our hands. We feel like 2,500 grafts is sort of an upper.
It's the maximum,
yeah, in one day setting, because it's a long day, and we don't want any risk. Now, I've read and seen other places, especially other countries, where they'll try to do mega sessions, 5,000, 10,000 even grafts in one day, or in 2 days. Some doctors even do 2-day surgeries overseas. Wow. Yeah, but those are very high risk procedures in my opinion. So
yeah, it seems like you'd be more comfortable just staying at that kind of safe number, doing it on one day, having it done. And 2,500 is that's a lot of hair.
You know? 2,500 grafts can be, say on average you have 3 or 4 hairs, that could be 7,500 to 10,000 actual hairs being moved. Mm-hmm. So the graft size, each graft can contain multiple hairs, like we mentioned earlier. So, and it's just safer that way. In these mega cases, you have a risk of, scalp infarcting. If you do 5,000 grafts, you might have necrosis of your scalp. You could have, an infection risk goes way up. Mm-hmm. All kinds of complications can arise.
And that's why we cap it at 2,500.
Exactly. We stay safe and it's beautiful work. And, if the patient needs more, we can always do some more another day.
Procedure.
Yeah, we can just do it another time and stage it.
And then, so now, does the most common size of procedures, does that change between women and men, or how does that vary?
It can, a lot of times females' pattern hair loss is different. It's usually more diffuse and it's kind of scattered throughout the scalp. Mm-hmm. A lot of times we're seeing kind of medium levels of hair loss, and we're sort of just filling in some hair. So I would say on average we do probably around 1,500 to 1,800 grafts for average case for mm-hmm. female pattern hair loss. Whereas for more advanced male pattern hair loss, we probably do 2,500 grafts if we can get them from the donor area.
Gotcha. And so I know when I see patients come in, they always ask, "So can I get my hair transplanted from a friend of mine or a family member?" Mm-hmm. Rather than have it be the hair on their head. Is that possible?
Well, the short answer is no. Yeah, it's theoretically possible, but no. We do heart transplants from other patients, but no, not for elective surgery. You have to take immunosuppressive drugs, and mm-hmm. it's a risky procedure, so no.
Yeah. And when we take the grafts from the back of the head, do those grafts grow back?
No, they're actually, it'd be nice. We're actually just moving them from the back to the front. So we're moving these follicles. I think of it as like digging up some of the shrubs in the backyard and planting them up in the front yard so everybody can see them.
For sure.
And as there's some growing cycles, and you might lose a few leaves, and it'll take a few growing cycles to really take root and take off. Mm-hmm. But it takes a year or so to get a really good result, and sometimes even a little longer after a hair transplant. But you'll of course see growth before that oftentimes. But yeah, we don't really consider a full result till at least a year.
Gotcha.
But, yeah.
And then, are there treatment options that we can pursue prior to a transplant that could increase how many grafts we have to give, like PRP or laser hair therapy?
Yeah, those things help for sure. Both, with hair loss, there's nothing that cures it, and we have a lot of stuff that helps, and that's mm-hmm. kind of where we are now. Someday there will be a cure. There's some new receptors being discovered at the follicle level. Clone research is going on. We'd love to do that, where we could draw the blood and clone brand new hair or something from the patient's own.
It seems like we probably would learn to clone hearts and livers first.
Yeah, it's all in research, but it's really complicated. But I think that there will be some advances made in the next 10 years. But
it'd be great. Yeah,
that'd be great. Yeah, but it is complicated, and at this point, yeah, we're limited to what we can move from the back of the head at this point.
Gotcha. So to summarize, a single graft might have several hairs, might have one hair. Typical procedure sizes for a hair transplant: 1,500 to 2,500 grafts. Maximum size that we want to stick to is 2,500 grafts. And that if we wanted to, if we're don't have as much hair to give, we want to try to increase that number. Things like laser hair therapy,
PRP.
platelet-rich plasma therapy. It can thicken up your hair, maybe even reduce the need to have a hair transplant. But it can certainly also thicken up the hair that we could use for hair transplants too. Okay. Well, thanks so much for watching. To learn more, you can go to myhairlossclinic.com. You can also schedule your free consultation at that same website. Thanks much, and we'll see you next time. Take care.
Bye-bye.